Okay, welcome back, Pahrump. And so if you didn't catch the first part of the show, I have with my guest tonight is Artur from the Pahrump Medical Supply. We're talking about obstructive sleep apnea as a shift from weight gain and obesity, meaning people that are obese have what they call obstructive sleep apnea. And if we go to the slide that I have up on the screen, it will basically show you the basic three forms of obstructive sleep apnea. Because that is in that format, obstructive sleep apnea, called OSA, is obviously the most common form of that. And the secondary form is called central sleep apnea. Obstructive sleep apnea is due to obesity. It's due to the fact that you have a physical impairment to the breathing mechanism. Usually, and obesity has to be the most common cause of that. Then there's central sleep apnea, which is due to basically a poor respiratory effort. And then the last one, which affects people here and there, which is basically intermittent or mild occasional sleep apnea, is when someone gets an upper respiratory infection. And it's not a dangerous situation. It doesn't need to be treated. The other issues do need to be treated, and they do need to be dealt with. And it's, again, what I talked about is the common most complaint that leads me as a physician to want to bring those to the attention is when a patient complains of fatigue. That's one of the things that is the most common thing. People rarely talk about snoring. They rarely want to talk about their weight. And I can't tell you how many people, when I bring it up, they say, well, I sleep really well. I know I do. And I'm like, really? How do you know that? You're sleeping. So it's a very common misconception that people sleep well, unless their wife, is a tattletale and says he snores like a freight train, and things of that nature. As you know, the government just changed their regulations regarding the commercial driver's license, and they've now make practitioners go through a training course to get your endorsement for commercial vehicles. And part of that is related to your weight, and if you reach a certain requirement, or if you're overweight, they're going to require you to have an overnight pulse ox study, or some form of study to prove that you do not have obstructive sleep apnea. And this has been coming down the pipe for a few years, and now it's here. And when I suspect that we have someone who has obstructive sleep apnea of any type, or they are fatigued, I tend to refer them to a group like Artur, or depending on the insurance, for what we call an overnight pulse ox. And it's not a sleep lab. This is one of the things that people get really afraid about, is leaving their house at night, sleeping in a bed, or doing something different than what they normally would do. The test is very simple, and we just basically place a pulse ox, which, I mean, a physician, when you walk in a physician's office, they do that. They check your pulse ox when you come in.
And that's true. And first, thanks for having me here, Dr.
Yeah,
Reiner.
you're welcome.
I think it's an important show for you. You're able to get information out to the people, for them to be able to get the remedy that they need for their whatever disease that they may have, and specifically in this case with the respiratory issues. Mm-hmm. And absolutely. Now, when we talk about the overnight pulse ox, as Dr. Reiner said, it is not an invasive test. It's very simple. It's done at the patient's home, and all it's consisted of is a finger pulse ox that's mounted on the fingertip, and you essentially go to sleep with it. Now, this is no different than any of the pulse oxes that you may have had at your doctor's office, with the convenience of a few seconds. We do the same thing with the overnight pulse ox, just for a longer duration of time. And this will essentially tell us what your oxygen saturation levels were throughout your sleep, and that can help your doctor determine whether you should or should not be using supplementary oxygen to alleviate some of the maladies.
Yep. And that's basically true. What we're trying to do is say that basically when you put that overnight pulse ox on your fingers, basically it's one of those things that they do in their home, and it makes it so simple. I mean, we basically find out how they sleep and what their oxygen concentrations are basically at night. And from that, we can get a lot of information regarding, you know, how they sleep. And then we can make the right therapeutic adjustment. One of the things I want to do is bring up a slide, and hold on just a second if we can get that going. I don't know if that will come up, but this is a typical, can we go to that slide so that I can show the public. If you can see on this, this is a typical overnight pulse ox of a patient who was complaining of fatigue. I can't obviously say his name. He's was in his 60s. He is slightly overweight. His BMI is close to 30, and he always complains of being a little tired, having some arthritic complaints, having a few other things. And as you can see, and it may be easy for the public to see. I don't know how well this is coming across your screen, but you can see that there are the squiggly lines. This is measuring the amount of oxygen in his blood, and you can see where it dips down in there, and you get these wild gyrations. Let's see, we'll go back up. Yeah, okay. So this is a better one, and you can actually see, I don't know if you can see my mouse on that screen, yeah. But yeah, there you can. And what you're noticing here is the actual dips below this line here. This is 90%. This is the normal saturation for the average public. And when you fall below 88% is when you are classified to be hypoxic, low oxygen level. And you can see if you follow this line across that, this particular person falls below that 88% quite significantly. And then they wake themselves back up, and then they sleep pretty well, and then all of a sudden, guess what? They drop back down, and your body has a natural alarm in there that actually wakes you up, and then you come back up to this above 90% oxygen, and then you'll dip down here and wake back up and dip down here. So no wonder you're never really feeling good the next day. You never really got continuous sleep. And in order for you as an individual to get really rested, you have to have REM sleep, which is called rapid eye movement. Did you ever watch The Matrix and they had rapid eye movement? So this is what happens. You have to enter REM, but it takes several stages of sleep to be able to get to rapid eye movement. And if you don't stay there for a period of time, you're never rested. Sure. And your body has this natural alarm that wakes you up. Okay, and it wakes you up out of that, so that what happens is your body wakes up, you never get deep sleep, your muscle tone increases, the obstruction opens back up, and you breathe, and then therefore you get tired and you kind of go back to sleep. And this happens throughout the night several times, and so people never really get rested. And the consequences of this are enormous. I mean, it affects every part of your body. If you're not sleeping well, you're not energetic. If you're not energetic, you don't feel like exercising. You'll develop arthritis. You'll gain more weight. Weight gain yields diabetes. Diabetes yields heart disease. I mean, it affects almost everything that you do. So, and people today take a lot of medication, and therefore one of the medications they'll take are sleeping pills. They'll take pain medication, and this actually is where this whole thing started, because one of the things, you're slowing your respiratory rate, and people don't really have obstructive sleep apnea where they feel like they all of a sudden stop breathing, but the medications basically cause a slower respiratory rate and a decrease in the amount of oxygen they move in, and that's called alveolar hypoventilation. We're going to go to break. I'm going to come back and I'm going to show you a couple more slides, and then we're going to demonstrate some of the equipment that we have to alleviate this issue. And thank you again for tuning in. We'll be right back.